Hey everybody, I have one more thing to say. I know this has been a lot of posts in the last 15 minutes. I have some things to talk about as far as the days after jaw surgery. You'll get out. Some people will have your top and bottom jaws wired shut. It's not really the norm anymore, at least from what my surgeon tells me. With my surgery, I had, I think, eight pretty heavy rubber bands, and I had those for a couple days until they all started snapping one by one, and it's not good. I think if that happens to you, definitely go see somebody. I didn't, and everything turned out okay, but don't really recommend that. It was sort of stupid, but I was way out of it, and I was vegging out on my couch watching TV the whole time, just chilling. So luckily everything worked out fine. Uh, some advice. Okay, so most places, or most surgeons, they'll tell you to eat liquids out of a syringe. Screw that. I'll tell you what to do. Go to Walmart, somewhere like that, Walgreens, what have you. Buy yourself a baby bottle. I'm not kidding at all. Cut the nipple like halfway on that baby bottle and just fill that full of soup. Eat, do all kinds of stuff. Because if you do the syringe, the big food syringe, that is just miserable. You wind up filling that thing. You got to clean it and just squirting a thin stream of soup or whatnot through a syringe is not cool. It's weird. But with the baby bottle, you can kind of get bigger chunks of stuff. Not You don't necessarily want big chunks of stuff, but yeah, you don't really have to puree it like you would for that syringe. And so definitely baby bottle. It was really nice. I had all my buddies come over. We're gonna have a poker game 3 days after my jaw surgery, and I got there early. I'm sitting there with my baby bottle, just chilling in my recliner in my apartment. So that was kind of awkward. Caught a lot of grief for that. So, but oh gosh, what else? That's one thing you can do. They'll give you pain medication. What I did for that, rather than try and swallow it whole or cut it up, you go to Walgreens and get a pill grinder, and just or a crusher or whatever they call it. The name is escaping me right now. And go and do that, and grind it up or whatnot, and throw it in some applesauce, and put that in your baby bottle, and do it that way. That worked well for me, and it was easy. Another thing about the syringes, I see people, at least on YouTube, I met a couple people in real life who, I say real life, who have used syringes. I feel like they just don't eat enough food because it's a hassle and they have to wash them, and they wind up getting really thin. I had a buddy who lost like 20 pounds in no time because he just wasn't eating. And that's an important thing to do, is to get your food. So that's baby bottle, in my opinion, is the fastest way to go. Because you can't do a spoon, even small spoons, because you have the rubber bands right here, and you're trying to fit a spoon through there, and that's just not going to happen. Not a chance. So that's the best way to go. Bottom line, just take care of yourself. If you have something like happened to me with the rubber bands, definitely call your surgeon up and make sure you're okay with that, because the last thing that you want to have happen is if your teeth set funny, because that just wouldn't be good, and I feel like it would be pretty painful. Plus you go back to your post-op doctor's meeting and your surgeon goes, "What the hell is this? What's the matter with you? You should have given me a call." So that's not something you want to happen. Anyway, but if I think of any more advice to give, I'll send it along. Just let me know if y'all have any questions and I'll answer them. Thanks.